Hi, my name is Jennifer Diaz, and I'm a student nurse from Cedar Crest College. For my evidence-based practice poster and paper, the topic that I chose was preventing pressure ulcers and the use of pressure ulcer reducing support surfaces. I became interested in pressure ulcers during my geriatric rotation on a med-surg unit. I had encountered multiple pressure ulcers at all different stages, and I started wondering, how do these pressure ulcers occur and how I as a nurse could prevent them. Repositioning a patient is a nursing intervention, but I figured that we as nurses could do more to prevent hospital-acquired pressure ulcers. So that brings me to my PICO question, which is, in a hospitalized patient at risk for pressure ulcers, does the use of a pressure-reducing mattress compared to a hospital standard mattress reduce pressure ulcers? So here with my poster presentation, I will answer that question. Hospital-acquired pressure ulcers lead to major complications to the patient and are difficult for the healthcare staff to manage. So it is important for protocols to be placed. A protocol that should be placed is the use of a pressure-reducing mattress or device for those at risk. Pressure-reducing mattresses mold around the patient's body and also distribute weight in order to take the pressure off of the patient. They work with the intent of reducing the pressure off of the patient and the mattress. So when I was researching the literature, I used search engines CINAHL and Google Scholar. The key terms that I used were pressure ulcer prevention, skin breakdown prevention, support surfaces, nursing practices, and interventions. The limitations that I had were publications from 2008 until present, peer-reviewed literature, full text availability, and nursing journals only. As I researched my topic through all of these restrictions, I did obtain 3 studies. My first study is by Brent et al., and it is a prospective control study. The purpose of the study is to determine the use of a continuous pressure mapping system and how the pressure mapping system would prevent pressure ulcers. So the results of the study showed that by the use of this system, only 2 patients acquired a pressure ulcer, whereas the group that did not use the pressure mapping system, 10 of the patients acquired a pressure ulcer. The second study, which was by Jackson et al., is a retrospective descriptive study. The purpose of this study was to present an aggressive care plan to prevent pressure ulcers. The results for this study were shown that with the use of an air fluidized bed, only 1 of the patients acquired a pressure ulcer, whereas 40 pressure ulcers were formed in patients that were not using the air fluidized bed. The last study by McGines is a systematic review and meta-analysis. The purpose of the study is to determine the effectiveness of pressure reducing devices. The results are pooled analysis showed that foam alternatives to standard hospital mattresses reduce the incidence of pressure ulcers in people at risk. Recommendations made by Brent et al. Are that by using pressure mapping technology, the outcome of a pressure ulcer is reduced in a hospital setting. Also, evidence-based measurements need further validation in the findings of the reduction of pressure ulcers and how the system is useful. Jackson et al. Recommended that setting protocols such as the use of the air fluidized bed will prevent pressure ulcers. It'll also prevent the complications of them, and it'll maximize the quality of care that is given to the patient. Lastly, McHines et al. Recommends that high-tech, low-pressure devices need more improvement and evidence in able to determine how they reduce pressure ulcers. In addition, more evidence is needed when collecting the equipment's performance and reliability. For conclusion, evidence-based practice should take place to reduce pressure ulcer formation. Therefore, pressure-reducing mattresses should be used to prevent, treat, and manage hospital-acquired pressure ulcers. Although it has been found that these pressure-reducing mattresses work, further and more quality research is needed. Okay, well, that's my poster presentation. Thanks for watching. Bye.